Hey dear soul, did you know that combat in the military changes the nervous system? It rewires threat detection and imprints memory differently? If you're dealing with flashbacks, nightmares, hypervigilance, or avoidance, you're not broken. Your brain adapted to survive war. Now we teach it how to live in peace. So let's start by understanding the symptoms. Flashbacks, intrusive sensory re-experiencing. The brain's fear circuitry, amygdala overrides present moment awareness. Nightmares, REM sleep, attempts to process unintegrated traumatic memories. Hypervigilance, persistent sympathetic nervous system activation. Your body is scanning for threats even when none exist. Behavioral and emotional avoidance prevents memory reconsolidation and keeps trauma frozen. Avoidance maintains PTSD. Approach heals it. So, prolonged exposure. This is a type of therapy developed by Edna Fall, F-O-A. So the core principle in this type of therapy is repeated controlled exposure reduces fear response through extinction learning. So how this helps combat PTSD is imaginal exposure recounts the traumatic event aloud in detail. Repetition decreases emotional intensity over time. In vivo exposure, gradual confrontation of avoided situations, crowds, driving, fireworks. Emotional processing corrects faulty threat associations. Teaches the memory is not the danger. PE is especially effective for avoidance, flashbacks, fear conditioning. Cognitive Processing Therapy, CPT, developed by Patricia Linsick. The core principle of this cognitive processing therapy is PTSD is maintained by distorted trauma-related beliefs. Common combat-related stuck points. It was my fault. I should have saved them. I can't trust anyone. The world is completely dangerous. CPT works by identifying cognitive distortions, challenging overgeneralizations, reframing guilt, shame, and moral injury. CPT is particularly powerful for survivors' guilt, shame, moral injury, and anger. EMDR, eye movement desensitization and reprocessation, developed by Francine Shapiro. It works by bilateral stimulation, helps reprocess traumatic memories so they become less emotionally charged. So first you recall a traumatic memory. Simultaneously bilateral stimulation, eye movements, tapping, tones, memory reconsolidates with reduced distress. EMDR is effective for vivid flashbacks, single intimate combat trauma, sensory fragments, sounds, smells, images. It does not require detailed verbal retelling like PE. Somatic therapies. Combat trauma is stored in the body. When the nervous system remains dysregulated, cognitive therapies alone may not fully resolve symptoms. Examples: somatic experiencing developed by Peter Levine, trauma-sensitive yoga, breathwork, regulation, body-based grounding practices. Those are some of the techniques that people use to heal. If you need, go back in the video to listen to them again. Somatic work helps with hypervigilance, startle response, panic, sleep regulation, muscle tension, dissociation. The goal: restore parasympathetic balance. Restore your nervous system so it's not on high alert and it's more relaxed. Increase vagal tone. Reestablish felt safety. So, group trauma therapy for veterans. Military trauma is relational. It happened in a unit. It involved peoplehood. It often involves loss. Group therapy helps reduce isolation, normalize symptoms, repair trust, process shared experiences. Veteran-specific programs such as those offered through U.S. Department of Veteran Affairs provide structured trauma groups. Group therapy is powerful for shame reduction, reintegration, identity rebuilding. Now, targeting each symptom directly. Flashbacks, EMDR, grounding skills, sensory orientation training, nightmares, imagery, rehearsal therapy, IRT, sleep hygiene, EMDR, somatic calming before bed, hypervigilance, somatic regulation, controlled breathing, CPT, challenging overestimation of threat, avoidance, PE, behavioral activation, gradual exposure hierarchies. The most effective treatment often combines stabilization, somatic regulation, trauma processing, PECPT, EMDR, and reintegration. Group therapy, identity rebuilding. Healing is phased: safety, processing, meaning making. Combat trains you to survive chaos. Therapy retrains you to live in safety. You are not your hypervigilance. You are not your flashbacks. You are not your worst memory. PTSD is treatable. Neuroplasticity is real, and healing is possible.